So, how should we do this? Who has some special event today but came here anyway? Like your birthday, an anniversary, a birthday of one of your kids, or what? Who? Yesterday? Is she the closest? A birthday yesterday. What? That's close enough. Okay, Ann, come on up here. You can get a pick of one of these books. Your Brain Has a Bent, Not a Dent. Or The Thresholds to Thriving. Or Amy Adventures, The Jungle. This is more of a children's book. Which would you like?
What was the first one? I'd like that.
Okay. You take the bent, not a dent. Okay. All right. Who has come from the farthest today? Farthest distance away? Thousand Oaks. Okay. Oh, I see some. What? Oh, hi. How high? Okay. Sherman Oaks. I think Sherman Oaks gets it. All right. Which would you like? There's. Yeah. So this one's for children more.
No, not so much.
You want that Thresholds to Thriving? This one's kind of on developmental stuff, but
If it's not the children.
it's not the children's, but it would be instructional for helping children. So it'd be for adults helping children. All right, then the last one. Who has, okay, since this is for children, who has the youngest child here? Twins what? How old are they? What's the youngest child? What? Do we have what? How old? -3. Oh, that's really young. Okay, all right, here you go. -3 years or -3 months? 3 months or 3 days? Okay, 3 months. There you go. Congratulations. That'll be a great thing for them. I hope that you're enjoying this. We want you to know there are also being continuing education credits that you can get for attending this. And this is for psychology, for nursing, for MFTs, for counseling, that type of thing. Arlene Taylor will give you credits, 1 hour of credit continuing education per session that you attend. So anything from 1 to 7 hours for tonight and tomorrow. So if you know of people that could use also that credit, bring them tomorrow, and so they can get at least 5 for tomorrow. All right? So, and that will be available. We'll be able to give you a certificate or some kind of. Right. She will. Yeah. Right. We've got forms that people will be able to fill that out, that information, and she will email them the real certificate. Yeah. So we will have them available. Yes, Beverly, you had an announcement?
Make sure those of you that are teachers, make sure you fill in the form as well, and I can give them the certificate of attendance.
Okay. Teachers also can get some continuing education. All right? All right. Well, without further ado, let's have welcome Dr. Taylor back.
I told you that I took nursing in the late 1800s. And back then, most doctors that I worked with didn't think nutrition had much to do with cancer. And there are some who still think that it doesn't have a great deal to do with the progression or development of cancer. Enter Dr. William Lee, L.I. Some of you have probably seen him on TED. And he is single-handedly revolutionizing the way that we look at cancer for people who want to pay attention. So here's a little bit of some of that information tonight. Cancer runs in our family. Different families have different risks, and some families have a lot of cardiovascular disease, but not a lot of cancer. Some people have a lot of diabetes, but not a lot of osteoarthritis and things like that. Well, Our family has a lot of osteoarthritis and a lot of, to wit, 2 hips. I set everything off at the airport before I get out of the car anymore. And a lot of cancer, so I've always been interested in cancer, and I'm really interested in the work of Dr. Lee. Albert Schweitzer, somebody asked me the other day, did you know him personally? The answer would be no, but I like some of the things he said. So read this with me. Each patient carries his own doctor inside him. We are at our best when we give the doctor who resides within a chance to go to work. Who's the doctor that resides within us? Our immune system. Good. Are you starting to tie these pieces together? And especially work by Dr. Lee are starting to show us how we can give the doctor within us a chance to work, even with conditions such as cancer. Even the word cancer scares some people. Every once in a while, especially if I'm working with students, I'll say, well, let's try it. I'm going to just say a bunch of words, and I want you to say them after me, and I want you to pay attention at how your brain and body feels. So let's go. Dog, cat, horse, apple, car, cancer. How did you feel when you said cancer? Some people notice a whole difference in the way their body feels. And sometimes, they're saying, apple, horse, dog in good volume, and then cancer, and they go, cancer? And you know that, and you need to say that until it doesn't bother you, because fear tends to downshift your brain. So if you're afraid of cancer, not a good thing for your brain and its connection with your immune system. So 2 fundamental causes for all disease, according to the authors of Never Fear Cancer Again, which is where I got the title for the presentation. Lots of factors influence the development of cancer, how fast it progresses, whether or not you heal from it, so on and so forth. They say there's only 2 fundamental causes for all disease. 1, nutrient deficiency. 2, toxicity. When you break things down to the bottom line, sometimes it's easier to get a hold of them as you look at your high-level wellness lifestyle. So they say the cancer process requires a specific body environment to sustain itself. Do you understand what that says? Every pathology has an ecology, meaning the environment has to be right for the pathology to sustain itself. Stop creating the conditions that allow cancer to thrive. Okay, we really didn't know how to do that. We knew some things about that, but now we have a much better grasp on how to stop creating the environment that allows cancer to thrive. And for many people, that gives them a lot of hope. Yes, there is something you can do about the environment, your body environment, that will make it more difficult for cancers to grow. So what's a tumor? Well, simple definition, it's a tiny microscopic collection of abnormal cells. Can be anywhere in the body, anywhere in the brain. This is what's fascinating. Read with me. Due to lack of oxygen and other essential nutrients on their own, these tumors cannot grow much beyond 1 to 2 millimeters, the size of the tip on a ballpoint pen tip. So you get a little collection of these abnormal cells in your body, and on their own, they're going to stay really, really tiny. Think about how big the tip on a ballpoint pen is. Because on their own, they can't get enough oxygen and nutrients to help them grow. Do you have any tumors in your body as we speak? It's highly likely you do. So vehicle accident autopsies. Big study of looking for tumors, microscopic tumors, in somebody who just died in an automobile accident. They didn't come in to ask the doctor to check them for cancer. So 40% of women between the ages of 40 and 50 showed they already had microscopic breast cancer tumors. 50% of men between the ages of 50 and 60 already showed microscopic prostate cancer tumors. They have no symptoms. They don't have cancer. But they've already got these little tumors going. And 100% of people by age 70 showed microscopic thyroid cancer tumors. So, throughout your body, you've got some of these little miniature clumps of cells. The question is, what's going to happen to them? So enter the term angiogenesis. Is that a new term for you? How many of you already know that term? 3 or 4 or 5 of you. All right. Well, for the rest of you, this will be stimulation for your brain. You just now have a new word. Angio comes from the Greek, meaning blood vessels. And genesis means what? The start of something, the beginning of something. So angiogenesis is the process of growing new blood vessels, especially new capillaries. So PNI stands for what? Good. Psychoneuroimmunology. The mind, the nervous system, and the immune system. Well, here we go. Angiogenesis. And angiogenesis means what in your own words? Good. You're growing new blood vessels. If you can say it in your own words, you're likely going to remember it. And when you're talking about cancer cells, these little tiny tumors the size of what? The tip on a ballpoint pen. Angiogenesis grows new blood vessels for the purpose of allowing oxygen and nutrients to reach those cells, including the cells of tumors. Now you've got these little teeny microscopic tumors, and you give them oxygen and nutrients, and what's going to happen? Tumor is going to grow. When on its own, it would have stayed tiny. So angiogenesis clearly happens during gestation, because that's when the fetus grows a lot of these new blood vessels. So angiogenesis during fetal development is not only appropriate, but it's very necessary. In adults, there's only a couple of times when you want angiogenesis. So you guys don't have to listen to the first part. And that is that any woman who's menstruating, every month there has to be an angiogenetic process to remake the lining of the uterus, just in case she might want to have a child. A lot of angiogenesis goes on that's not needed, but nevertheless. And the second time in adulthood when it's appropriate is if you get a wound. You know, when I had my second hip surgery, my surgeon, who I will love till the day I die, I tell you, you put your life in somebody's hands, and I'm so grateful when they know what they're doing and they can help my health. I couldn't replace my own hip. So he did a fabulous job. Oh, and by the way, there is research that if you want to hang on to your marbles as you get older, general anesthetic, if you can possibly avoid it, is a good thing to avoid if you're over about the age of 50 or 55. Well, I'm slightly over the age of 50 or 55. So I went to my surgeon and I said, I want to have a spinal. He said, what? I said, I want a spinal. I don't want. I need to take care of my brain because I write and speak and I need to hang on to my brain function. And, you know, having your hip replaced is a fairly dramatic procedure. Well, he says, I'm willing to do it with a spinal, but he says, you do realize that you're going to hear me sawing off your bone, and you are going to probably smell some cautery as I stop the bleeding, and you are going to hear me whacking away with a hammer, pounding in the prosthesis. He said, are you up for that? And I said, you better believe I'm up for it. Okay, he said, we'll do it. So they did give me a little propofol. You know, that's what killed Michael Jackson. But it was in a hospital setting, and the anesthesiologist knew what he was doing. He says, I'll give you a little propofol because then you won't remember everything. Oh, I remember a lot, except I don't remember the surgeon said to me, he said, boy, we had some interesting conversations during your surgery. I said, we did? I don't remember that. He said, yes, don't you remember saying such and such? And I said, you got to be kidding. I didn't say that, did I? So anyway, think about that. There are some times when you wouldn't be able to do a spinal, but if you have the choice, take care of your brain, because it takes a long time for a general anesthetic to get out of the cells of your body, and some people, as their brains get older, it doesn't do so well. How did we get on that subject? So, menstruation and, oh yes, wound healing, of course. So he makes this incision, and I just, you know, really paid attention to how that healed because I could actually see it. And every day I'd check it, and it's just amazing how quickly the body starts healing that, and it's a pretty substantial surgery. It's just, I have such a regard for my immune system. Now, angiogenesis, okay, so obviously you need to have it when you're pregnant and you're trying to get this little fetus to grow. When are the 2 times in adulthood when you want it to happen? Menstruation, and if you get an injury. Nobody seemed very comfortable except Betsy saying menstruation. Man, this is not a high school class, folks. You all know that women menstruate. Okay, the 2 times, menstruation, wound, good. I don't know what they're doing in schools these days, but when I was a school nurse, I mean, we learned all these terms and we talked about them because it's just part of life, and when you can't talk about them to your adult partner, how are you going to talk about it to your kids and grandkids? That's the problem. It doesn't happen. They get their information from somebody who doesn't know what's going on. All right, the regulation piece, whether it happens or not, is controlled, if you will, by activator and inhibitor molecules. So think of it like a light switch. You turn the light switch on and it activates things. You turn the light switch off, the lights turn off, and you inhibit the process. So normally, the inhibitors there's a lot more inhibitors, especially in adulthood, because you don't want that process going unless one of 2 things is happening: menstruation or wound, all right, or both. But when you've got this little collection of tumors, during the process of creating those additional blood vessels so you get oxygen and nutrition to those abnormal cells, something happens with this activator-inhibitor ratio that is not pretty. What happens is it just turns it on its head. So that instead of the inhibitors, the light switch being off most of the time, and only turning it on for 2 reasons in the female and 1 reason in the male, everything gets flipped on its head, and instead the inhibitors don't work. they're just, they don't work like they're supposed to, blocking the growth, and the activators just pour out. And so you get angiogenesis when you don't want it. And that can give you a lot of problems. So I'm indebted to the American Cancer Society for these slides. So ordinarily, here we go. Everything's working well on the left side of the slide. So the inhibitors are high. The light switch is turned off. There's no need for angiogenesis. What does angiogenesis mean? The growth of new blood vessels. Good. And the activators are very low, so occasionally there might be a little cell division there that is related to the angiogenesis. You know, you cut yourself with the knife, something like that. However, it gets turned on its head with these little tumor cells, and all of a sudden the inhibitors are low and the activators are going wild, and now you've got all of this cell division and the growth of new blood vessels. So what is tumor angiogenesis? Well, it's the growth of blood vessels in tumors. And when you have this little group of tumor cells, they begin to put out an enzyme that's called a signaling molecule, meaning it's like a messenger that says, come on, let's grow some blood vessels here. I'm not getting enough oxygen. I'm not getting enough nutrition. I want to grow. Give me some angiogenesis. And researchers used to think that what happened for a tumor was that the blood vessel was the blood vessel, and it got fatter and fatter, if you will. The size of the blood vessel enlarged, so more blood got to the tumor. No, that's not what happens, according to Dr. Lee. You actually get the growth of new blood vessels that now bring oxygen and food to that tumor, and it starts growing and spreading. So what's metastasis? Metastasis is just a tumor that has started to grow because it's got more blood vessels, more oxygen, more food. And now a piece of that breaks off, floats away somewhere down through the circulatory system, lodges in another part of the body, and the whole process keeps growing. And then eventually, for some individuals, a doctor takes pictures of their body and they see new clumps of tumors everywhere, because of this process of angiogenesis and then metastasis. All right, let's talk about a couple of things before I give you some of Dr. Lee's research. Obesity and angiogenesis. I already mentioned that if you are overweight, the single best thing you could probably do for your immune system and your brain is to get to your normal body weight. Fat tissue is highly angiogenetic, just like tumors, meaning how many miles of capillaries for 1 pound of excess fat? Good, well, I'm sure you can read it, but you know, you need to know that. That's a lot. I drove 400 miles to get here. That's how many miles my heart would be pumping blood through just for 4 pounds of excess fat. I mean, think of your heart doing that with every pump for nothing. All the way from Napa Valley to Camarillo for 4 pounds of fat. It's no wonder that obesity tends to shorten your life, because your heart's doing all this pumping that it didn't even need to do. So, anti-angiogenesis factors, meaning things that stop the growth of blood vessels, can even have a positive effect on obesity, because if your fat tissue is highly angiogenetic and you don't give it oxygen and nutrients, guess what? You're going to lose some of that fat. And if you're female, listen up. It's even worse for women who are overweight than for men. That is not, men, that doesn't mean that, you should gain weight. It means that everybody needs to be at their optimum weight level if you want to be really healthy for a long time, but when you compare males and females, it's even worse for females. Latest research I found was this. For a woman who has been obese her whole life, now that's more than just being pleasantly plump, obese her whole life, she has an 85% increased risk of early dementia. It's not worth it. So I'm really serious about maintaining an appropriate weight for my height. My family on my mother's side, I say that we have the West Coast concession on obesity. I don't think there's any woman in that side of my family that's more than an inch taller than I am, and every single one of them, except for me, is over 200 pounds. And as I grew up watching that, and then I got the research, I said, I need to make a different choice for me. Now that doesn't mean I'll live to be 130 with a sharp brain, but it means that I'm going to minimize, based on weight, problems with dementia. What about stress and angiogenesis? Well, animal and human studies have shown a really close correlation between uncontrollable stressors. Now, the term uncontrollable stressors, my brain has a different opinion. If they mean uncontrollable in that, you can't avoid taking exams at school, okay, I can deal with that. But there's also wonderful research that you can do a lot to manage even stressors that you're choosing. But here's some of their examples. Examinations, can't get your piece of paper unless you pass. Caregiving, especially if you've got chronic illness or a child that's really got some developmental delays. Your partner walks off and leaves you. You have a child who dies, chronic illness, dementia, so on. A correlation between that level of stress and angiogenesis, which is the reason that some of you know that often the caregiver dies before the person he or she is taking care of because of the stressors. So most of our research, most of our treatment in relation to cancer, up until fairly recently anyway, has been based on how do you kill those little puppies? How do you get into the body and kill those cells so that they stop multiplying and dividing? Every once in a while, somebody shows up on our planet that has a different idea. And I'm always fascinated with that, and I wish I knew what happens in their brain to give them that idea. And this isn't anything new. Galileo, for instance. Didn't know him either personally. However, Galileo had one of these brains that comes up with a new idea. Do you remember from school what his new idea was? He said the earth is round. And everybody else that he knew on the planet at the time said what? It's flat. Are you nuts? And they didn't like it. He belonged to a church. What did the church do? Excommunicated him, rubbed his name out. What else did they do? Put him on house arrest. So here's Galileo. The only thing he said was, the earth is round. And he thought they were going to just flat out kill him. And after he'd been on house arrest for several years, guess what somebody developed? The telescope. And once we had the telescope, what did we discover? The world is round. I don't know if they ever let him back in church, but at least they didn't kill him. Okay, how did he figure that out? I think Dr. Lee is a Galileo. And instead of saying, what else can I invent to kill cancer cells? Because when you kill cancer cells, with some exceptions, you kill healthy cells too. He directed his research to what could be added to one's food intake to starve cancer cells. So you can go to TED and you can look up Dr. William Lee, Angiogenesis Foundation, and you can watch a wonderful clip, I think it's wonderful, of him explaining his work. And it's understandable. You know, he does it in a way that the average person can figure it out, so you might want to do that. In fact, if you go to my website and click on the PowerPoints that talk about self-care in times of stress, I think I might even have the link on that, on my website to a YouTube clip of his. All right, so his research, and he did it very much like we were talking about before. You put some white blood cells in a test tube and put in some tumor cells, and you wait how long? 3 hours. Good, you're getting it. You wait 3 hours and then you count how many tumor cells are left. Well, he would take tumor cells and put them in a test tube, and then he would test one after another different types of foods to see what they did to the tumor cells. And even he was surprised as he began to discover that some foods killed the tumor cells. There were less of them after 3 hours than there were to start with. So the first thing he found was that there are some foods that help to fight cancer, and those foods should be high in these different types of substances. And they're found in these types of foods. And we already know that bok choy, cabbage, broccoli, and cauliflower, if you've been studying anything about nutrition, are good for your immune system because they contain brasinin. And then you got lycopene in tomatoes, and you got omega-3 fatty acids in fish and tofu, and you got antioxidants that fight against free radicals. Do you know what a free radical is? It is not somebody who is out of jail and has some really strange ideas. An antioxidant, a free radical, you know, ordinarily you find electrons, if you remember this back from high school, you find electrons in pairs. They always want to be in pairs. And a free radical is an atom or a molecule that's lost one of those electrons. And it doesn't like to be missing an electron. So it will go throughout the body and try to steal an electron from another healthy cell, so it's back to having two. And that's the reason you have wrinkles on your face. Wrinkles on your face are due to these abnormal free radical pieces. And so when you take an antioxidant, think of it as Santa Claus with his big bag of candy canes, only he's not giving out candy canes, he's giving out electrons so that the free radical doesn't have to steal from another cell. You got all of these free electrons in your body based on what you're eating, and they can now repair themselves, and it's a whole lot better than having them steal from your skin or your eye or your brain or whatever. And lots of antioxidants in berries and artichokes. So they help fight cancer. So you would want these, by and large, or some of them in your diet. Now, he found that some foods starve cancer cells. What a deal. Red grapes, blueberries, cranberries, strawberries, mangoes, soy, those foods starve cancer cells. And you can go to his website Angiogenesis Foundation and get lists of foods that he has found in his research that will starve cancer cells. How revolutionary is that? Beets, tomatoes, garlic, again, bok choy, cabbage, cauliflower, broccoli, papaya. I eat all of those things. I ate some of them before, but not in the amounts that I do now. So this is just one example of naturally occurring anti-angiogenic substances, and that's one of the things from his website. Somebody the other day called me up and said, I saw red wine on that list. I don't drink wine. I said, you don't need to. There's plenty of other things that you can do. You do realize that it's not the alcohol that's anti-angiogenic. It is the stuff in the skin of red grapes. So if you drink wine and you want to drink red wine, you'll get some anti-angiogenic response. But here's the problem: there's new research that alcohol can increase certain types of cancers. So for me, I'll take the red grapes with the skins on them. But that's going to be a personal decision. Did you notice dark chocolate here? Isn't that a deal? But he's talking about cold pressed chocolate that's, 70, 80%. And believe me, it's one of the things that's now recommended for women who have PMS, because of some of these things. So if you want to prevent PMS, just have a little dark chocolate. But we're talking about, one little square. We're not talking about a whole bar. It reminds me, my first PhD was in Health and Human Services with an emphasis in women's issues, of which there are none. I was very clear with about that when I got to my defense. And it was really kind of interesting because I walked in to, defend my dissertation, and one of the men sort of folded his arms and leaned back, and he said, well, minor in women's issues, huh? What have you got to say about that? I said, well, I can tell you there are none. And he looked at me and he says, excuse me, we've offered a minor in women's issues for a long time. I said, yes, and there are none. He said, do you mean to tell me that PMS is not a women's issue? And I said, well, sir, and I'm thinking, ooh, somebody in his family's got it. I said, this is my belief that there are issues that impact human beings, period. They may impact women a little more or men a little more, but they just impact human beings. I said, I can't imagine a woman with PMS not impacting the men in her family. And he looked at me and he goes, okay, we're done with that line of questioning. I'd love to know more about his family. So you can look this up and make sure that you have those in your nutritional intake on a daily basis. So this is the summary according to Dr. Lee. If you can reduce angiogenesis, you can slow down tumor growth. Tell me the reason that would slow down tumor growth. Yes, reduced oxygen and nutrients, so they're not going to grow. If you can block angiogenesis, the tumor can't grow because it just can't get oxygen and it'll stay little. It won't die necessarily, but it will stay little. Now, this is what he says. If you can stop angiogenesis, tumor cannot metastasize. Remember when we started, we talked about the fact that every pathology has an ecology, meaning the environment has to be right in order for cancer to grow. Well, Dr. Lee says this: your food choices are responsible for 30 to 35% of a cancer-friendly environment. How does that grab you? There are other things, of course, but that's a third. So read that with me. Your food choices are responsible for 30 to 35% of a cancer-friendly environment. So what you eat is going to make your body environment conducive to the development of cancer or less conducive. And Dr. Hans Deal, that started the CHIP program, was on the track of this new research because his whole thing was what you eat matters. It makes a difference to your health, certainly in the area of cardiovascular disease, but now also in the area of cancer. So we're back to Albert Schweitzer. Read with me. Each patient carries his own doctor inside him. We are at our best when we give the doctor who resides within us a chance to go to work. You're the only one that can do it for your brain and body because you have the lease for that brain and body. And now, thanks to work by Dr. Lee, he's showing how you can give the doctor within you a chance to go to work, specifically related to reducing your risk of cancer by reducing angiogenesis. With a family that's filled with cancer, that's really, really good news for me. So I would encourage you to go to TED, listen to his little YouTube clips, and get serious about giving the doctor within you a chance to go to work, reducing the ability of tumors to grow, maybe even stopping them altogether so that you have no metastasis. And I'm very thankful personally to people like Dr. Lee who for some reason get this idea, follow it through, and then do landmark work that can help the rest of us have a better life. So I will see you tomorrow morning at 9:30 and we'll talk more about the brain.
Well, thanks for coming out tonight. So now I have a new concept, and thanks to Dr. Taylor. The new doctors of today, the best doctors of today, the best doctors of the future, what will they be doing? They will be helping patients develop their own doctors within. That's what they'll be doing. They won't be pulling off, external kind of stuff. They will be helping the patients. They will collaborate in helping those patients develop their own doctors within to the highest level of functioning as possible. That will be where the future of medicine is. So we thank you for coming out tonight, and we'll just pause for a word of prayer to send you off tonight. Father in heaven, we thank you for your blessings. We thank you how you've created us. So fearfully and wonderfully and awesomely are we made. And we were created in your image, which means you are awesome and wonderfully a person. We thank you how you've created us, how we can have you set instructions for us that we can live in harmony with how you've created us so that we can live full and abundant and healthy lives that will in turn glorify you but also bless each other. Thank you for these blessings. May we continue to learn ways in which we can put ourselves into harmony with your laws that have been created so that we might be in harmony with them and be fully functional as you've wanted to have us, and that we can fully have a relationship with you in all of its aspects. We praise you in Jesus' name. Amen. Good night, and God bless. We'll see you tomorrow.